Welcome to Senior Moment with Nurse Linda on continuation of Breast Cancer Month. This is Dr. Charles Campbell, the man behind the camera, and this is we gotta get some music in here. This is Nurse Linda, and we're talking about surgical care
Yes,
on Breast Cancer Month.
yes. Today's discussion is going to be all about treatment, period, but we're going to start out in this segment with surgical treatment
And our second segment is
about the more traditional chemotherapies, hormone replacement therapies, things like that.
and the third, this is good.
Newer and more controversial therapies.
Right. If you got a
Yes.
breast or two, you want to hear this.
Men and women.
Men and women.
Men and women.
I have two.
Yes. With all of the different treatments we're going to discuss, we'll always be discussing risk versus benefit. And that's what a doctor will discuss with anyone who's gotten a diagnosis. And in the past segments, we've talked about what breast cancer is, getting the diagnosis, the procedures that are involved. Now we're going to talk about treatment. If you have gotten a diagnosis, most of the time the first line treatment is surgical treatment. Physicians will want to remove the breast cancer, and I think most men and women want the breast cancer out. It's a little disconcerting if they have to leave it in for chemotherapy and things like that first, although sometimes that's a good first line as well. So we'll discuss those differences.
Surgery has changed drastically. I've seen photographs of early mastectomies
Yeah.
that no wonder women would rather die than have this surgery.
Oh, the complications related to those types of mastectomies back then were horrific. They were called radical mastectomies.
Yep.
They rarely do those anymore. They're just not needed, and that's what they've learned through clinical research. And we're going to talk about clinical research trials as well. The first type of surgery that is most often done is called a lumpectomy. And I want to make sure because there's different levels here. The lump itself is removed along with a small amount of healthy tissue. And they do that once they look at it under the microscope. They want to make sure that there are no cancer cells that are spreading into that tissue. They call them margins. They want clean margins. So that's the first one. And that usually, depending on how deep and how much tissue they have to remove, you may see absolutely no difference in the breast whatsoever. You may see a small dimpling. And anything, if someone is really bothered by that, they can have reconstructive surgery and repair that small area. Another part is called a partial mastectomy, and that's when the lump is removed along with a larger portion of the breast tissue. That will definitely disfigure the breast or the chest area in men. They may also remove some of the muscle lining under the lump. And when you have to remove muscle lining, that's when you get more of a deformity. But again, that's still eligible for having breast reconstructive surgery done fairly easily. Then you run into a total mastectomy, where it's also sometimes called a simple mastectomy. They removed all of the breast tissue and probably some lymph nodes. And we're going to talk in a minute about why lymph nodes are important. Then you have a modified radical mastectomy, which is the whole breast tissue, many lymph nodes, because the tumor was large enough, they're concerned about them reaching the lymph node area.
Why would it be that large? They have somebody not doing breast checks?
It could be if they're not doing breast checks, if sometimes even all of our technology cannot pick something up because of the location of it. And that's the problem. That's where both breast exams and mammography and a professional exam once a year by a physician helps to prevent that from happening, but it doesn't always. And some cancers are that aggressive that they grow all what seems like all of a sudden. So sometimes that's needed. So you're removing on a modified radical mastectomy the whole breast, the lymph nodes, the lining over the chest muscles, and sometimes part of the chest muscles as well. So you're dealing with 3 different layers.
They remove the skin as well?
Yes. Yes. They'll keep enough skin to repair the area and close it up, but they want to get out as much as they can, and that's part of it as well. They do many times something called a sentinel lymph node biopsy, and this is very interesting. The first time I saw this done was with melanoma. They inject a small amount of radioactive dye into the area right near the lump. And then they follow it with a little Geiger counter device and see where it drains to. The first lymph node that it goes to is the sentinel lymph node. That's most likely, if cancer cells were going to drain from the tumor, that's most likely where they've gone.
That's interesting.
They'll remove that sentinel lymph node only. And there's a reason for sparing the lymph nodes. And they look at it under the microscope. Once they remove that, then they go in and do whatever other surgery they have determined is necessary, whether it be a lumpectomy or one of the simple or modified radical mastectomies. Once they determine if that lymph node is affected or not, if they feel if the sentinel lymph node is not affected by cancer cells, they don't have to take any other nodes. Once you start taking lymph nodes, which are multiple under the arm area, lymph nodes drain fluid. They keep infection away. Once you take a lot of these out, the fluid in your arm doesn't drain correctly all the time. And this is where women end up with complications called lymphedema. Their arm is permanently swollen. And there's a lot of wonderful therapies for that now. And next week we're going to talk about some of the complications of treatment. So we'll discuss more about lymphedema next week. Then you have what used to be what you were referring to, the radical mastectomy, which they just don't do anymore. They would take absolutely everything they could find, tissue, muscle, every lymph node they could pick up. Many women were left unable to use that arm because of weakness, because the lymphedema was so bad, because nerves were involved. They're just not needing to do that anymore. The best treatment is the treatment that you and your physician determine is best for you as far as the surgical approach. Ask questions. Do research. Do reading. There's multiple sites to go to where you can get information from. And we'll put these on each of the segments, and that is cancer.gov, cancer.gov. The phone number for that is 800, the number 4, and the word cancer.
Again,
The number 1-800, the number 4, and the word cancer, cancer. And those are the best places to get some basic information and get your questions answered before you go into it. Know all the possibilities, know what your options are.
your chances of survival are good.
They're very good these days. Yes, that's the good news.
Well, I'm glad that there's good news. You've been
Yeah.
listening to part 1 of Breast Cancer Month.
Yes.
Senior Mo with Nurse Linda. We'll be back with part 2, which is,
Chemotherapy and other standard treatments.
that's what we're looking for. Stick around, folks. Watch for part 2.